I just want to do a quick intro for Nicole, and then we will hand it over to her to tell us a little bit about the national guidelines for recovery community centers in, well, national, so everywhere. Nicole joined PRCC in 2018 and has since worked with many communities throughout Maine to establish and build recovery community centers in their area, providing education, technical assistance, and training to grow Maine's statewide network of recovery community centers. So with that, I will pass it on to Nicole, who is going to share with us some information and hopefully be able to answer some questions along the way.
Great. Thank you so much for the introduction. I'm so happy to be here with you guys. As Shauna mentioned, my name is Nicole Proctor, and I am the program director here at the Portland Recovery Community Center, and specifically around technical assistance for new and existing recovery community centers, as well as statewide trainings for recovery coaching, supervision of recovery coaching, and advocacy work for people in recovery and substance use disorder. So I love what I do. I am a person in long-term recovery, and I just think that's really important to share because one of the main premise of a recovery community center is it's people in recovery helping people in recovery, right? And so I just came out of a meeting this morning that we have here at our center, and Gordon Smith is here and Sam Canonis is here, and we were introducing ourselves, and we were introducing ourselves as people in recovery along with the substance that we use, which isn't typical, but we've had people visit our center before and say, when they were leaving, they say, now we want to go see some real addicts. Like, they don't believe that as people in recovery that we were ever, you know, a quote unquote real addict, right? So, so it's putting, recovery is putting that face out there and like breaking that stigma that we can and do recover. So, so yeah, so I do have a presentation. Let me just share my screen here. And then I'll just say, if anybody has any questions at any point, feel free to come off mute, because when I'm sharing my screen, I can't really see you guys. So if anybody has a question, feel free to just come off mute and ask. And I did shorten my presentation because I wasn't quite sure how long I had. So we might kind of zip through this. So we can, you know, I'm free to take any questions. So. Find my present button. There it is. Can you guys all see that? Perfect. All right. Sorry, I'm just trying to get all of our faces out of the way so I can see my slides. Bear with me. You would think that after 2 years of doing Zoom and presentations that I wouldn't have these kind of issues, but hey, we all still do. So again, this presentation is on recovery community organizations, and what I'm hoping that you get out of this presentation today is a little bit more information about the overall recovery movement nationwide, the basics of what an RCO, a recovery community organization, is, and then what's available on a national level, and then what's available here in Maine for support as you're growing and opening and building in your own community. So this was shocking to me when I came into recovery. I didn't realize that that recovery happened, as far back as the 18th century. So when we talk about recovery, it has somehow become synonymous with 12-step, 12-step fellowships, and that happened in the early 1900s. But no, it actually started way back with Native American recovery circles. And then that grew into alcohol mutual aid societies. And then all of that gave birth to the 12-step Alcoholics Anonymous in the early 1920s. Since then, there's an anonymous fellowship for literally everything, from food to sex to narcotics to gambling, pretty much anything. And then as far as like the modern recovery movement is concerned, it's really kind of burst onto this like scene in the last 20 years or so. So like in the late 1990s, it really became this push. Both state and local communities were at the time starting to open recovery community organizations, not really knowing what that was at that point. They were just starting, right? So what an RCO is, and what I like to just put out there right in the beginning, is we often will say Recovery Community Center here in Maine, or an RCO, which is a Recovery Community Organizations. They're used kind of synonymously, like interchangeably, I mean, and there is a slight difference, but I'll get into that later. But if in case you hear me say a center instead of an organization, they're really used interchangeably here in Maine. So in the last 20 years, the RCOs have been growing across the nation. It is a national model, and it's a peer recovery support service model. So everything that you find in an RCO would be peer-based supports of some sort, and typically free. We here at PRCC and at the recovery centers all over Maine, we don't charge for any services. So you can receive peer recovery coaching for free, telephone support for free, and then of course meetings or wellness activities for free. Like we have, I think, 3 or 4 yoga classes a week here for free, art groups for free. So it's really just all peer-based and free services. And then back in 2007, the federal government, so SAMHSA, actually acknowledged that peer recovery support services are an evidence-based practice model. So, which was great, because for a long time, you know, people would say, yeah, but that doesn't really work. Actually, like the sense of building community with your peers is one of like the main things you need for sustained recovery and for a meaningful life, right? So you don't go back to a recurrence of use. So it is really important. So when that happened and SAMHSA said, hey, this is actually evidence-based, we're like, yay. So that's great. So the national recovery movement shares some pretty basic goals, no matter where you are in the country or what center you might be at or who you might be talking to. The basic goals of an RCO are to build grassroots recovery community organizations that are strong and that advocate for meaningful representation of people in recovery. Many, but not all, may do education. So similar to like what you guys are doing and bringing a group of people together and educating the community and maybe service providers in the area about what is a recovery ready community and how can we celebrate recovery in our area. And then really supporting all of the different pathways. So as I mentioned before, you know, everybody's pretty much heard of 12-step fellowships, right? But there's so many different pathways to recovery that are not talked about as much and that some people may not know. And we've all heard people say, you know, that 12-step doesn't work for me, but they don't know that there's other options out there. So a recovery community organization really shines light on all of the pathways and becomes a place where it doesn't matter what pathway you're using, you're going to find connection and options at the recovery centers. It's really the first time that multiple fellowships and multiple pathways have come together in the same space and just celebrated recovery as a whole, opposed to a specific pathway of recovery. So some of the basics about what is an RCO. An RCO, typically by definition, is independent. It's a nonprofit organization with a 501c3 status, and it's led and governed by people in recovery. So typically, you're going to have a board of directors with a nonprofit, and so more, 51% of that board would be people in recovery. And then, for example, here at our center, we have, I think, 18 staff right now, and all but one identify as people in recovery. So it's just really important that people in recovery are represented on the board and as staff for a peer center. And then I think I mentioned this a few minutes ago, but some of the basics that are provided at most centers or RCOs around the country is, again, peer-based recovery support services, which I just talked about, like recovery coaching, telephone support, and meetings, of course, meetings of all kinds, whether it's wellness activities, dances, holiday suppers, whatever it might be. And then policy advocacy activities, which again, not all centers do, and the community education. So for example, we would go out in the community. We recently met with the Biddeford Police Department with their monthly training, and we did a stigma and language training with them. Not all centers would be doing that, but that is some of the work that we would do. We also work with healthcare providers. Right now, we're doing a project around the recovery Bill of Rights. So it's a Bill of Rights for people in recovery, and we all know, or maybe we don't all know, but a lot of people in recovery know that going to the doctors can be a traumatic experience. Even after you've put down substances and you're in recovery, you're still treated like there's something wrong with you. Sometimes you receive subpar care. You're treated like you're less than. Sometimes your symptoms aren't treated the same as somebody else's symptoms might be treated. So we're working with healthcare providers and people in recovery to do a statewide training to get the word out about the Recovery Bill of Rights. So that's really exciting. And I will say that the attitude of healthcare providers about the project is promising and also very exciting. So that's probably the most exciting part of it, is that healthcare providers are actually getting to a point where some of them are listening and trying to do better. So baby steps, that's how we get there.
Nicole, can I interrupt you for just a moment? I'm not sure if this is the right place for this, but I have a question about the difference between like a recovery center or community organization and a crisis center.
Okay, yep. So absolutely great question. And so what I would say is, like, crisis centers are typically more of a mental health focus center. Here at PRCC, I would say we don't not get people coming in crisis. However, we would then reach out to like Sweetser or the hospital. We're not trained like crisis interventionists. What we are is, if you want help in recovery. So I guess what I would say is the centers are designed, and I'll preface this by saying that this doesn't happen everywhere, and I'll tell you why in a minute. But so a recovery community center is designed to be for people in recovery or people seeking recovery, right? So it's actually once you've put down a substance or as you're trying to put down a substance, and it's building a community where you can make those healthy relationships and find healthy activities with people who are also on the same journey as you. So if you think of it in that aspect, it's not necessarily where people would be in crisis a lot. Does that make sense, Shauna?
Yes, awesome, thank you.
Okay, and then what I will also say is that in rural areas, like where you are, that might not be the case. I would say that as a grassroots organization, you should respond to what your community needs and what your community wants. And that can be hard, right? Because you want to create a safe space for people in recovery, right? Because that's the true goal, is like a safe space for people in recovery.
Well, I see that.
Yeah, sorry, I was just eating some garlic pitas, so if I smell like garlic, I apologize. What have you been up to?
Hold on. Somebody's not muted.
I'm a recovery coach.
Oh,
Emma, can you mute your?
other than me coming out of recovery?
Thank you. So as a grassroots organization, you guys should respond to what your community needs. But if you truly want to be a recovery community center, you should be more focused on building a space to support people in recovery, and then having the resources for the people who need safe supplies, or harm reduction supplies, or looking for treatment, having the resources available to give to those people and help them find them. But we can't be everything to all people. It's really hard because we need like there's so few resources in our state that sometimes we try to be all things to all people. But if we really can know the resources in the state and just help people find what they need, and try to be a safe space for the people in your community to actually be in recovery. And it does take a while. I will say, even in Portland, when we've been open for, this year's our 10-year anniversary. It took, I wasn't here, but Nancy, our program manager, was here from the day that we opened. And it took a good year for people to start walking through the door. It was a very quiet place. In Portland, it's a big city and there's a lot of recovery here. But it takes a while for people to understand what we do, and that we're a safe space to hang out, to meet other people in recovery, to hold meetings, to just to give back and volunteer. It takes a while, especially in more rural areas. Some of the more rural community centers have been doing, because they don't have a lot of staff, they're not open 5 days a week, 7 days a week, 8 hours a day. They might be open 4 hours a day, 3 days a week, or something like that. So what they're doing is spending that time going out into the community and making relationships, letting people know who they are, what they do, trainings with their police departments, just doing some of that public education to help break some of the stigma, because initially it's hard for people to come out in rural areas as a person in recovery, when traditionally they've stayed anonymous and quiet for a really long time. And for people to feel safe, the community has to change too, they have to feel safe. So yeah, that was a very long answer to your question, Shauna.
I think it's important because one of the things in our area in the Maine Highlands that we are kind of aware of the challenge of is that there is a lot of stigma and there's a lot of not really misinformation, but just a lack of information. You know, not really knowing what it means to have a recovery center or what that looks like, or, you know, how to address the fears that go along with that.
Yeah, absolutely. And, you know, you'll find that, I don't know if you have a space picked out. I can't remember if you told me you did or not. A lot of places might, you know, you might find the perfect space. This has happened several times in different areas in Maine as centers have been looking for spaces. You'll find the perfect space and you'll get ready to sign the lease. And then they'll say, oh, you know, I didn't realize quite what you did. And we don't want those type of people in our building. And they don't understand that it's a recovery community space. And, you know, it's not active use. You know, it's not a treatment facility. You know, we're not detoxing people. We're not providing treatment. We're a community center, just like you know, the Franco-American Center is a space for people to use. Like, it's a community center for people in recovery, and so I've heard
You don't want
stories.
those people around here either. That's what that sounds like to me. Right.
Yeah. I mean,
that sounds like to me. I'm sorry, but that's what that sounds like to me, is that, oh, we don't want to have those people around us either.
Well, and the funny thing is that a lot of places, they don't know the difference between recovery and active use because people in recovery have been in the shadows and quiet for so long. They don't realize that, like, you know, if they have 10 employees, there's probably at least one person who has either experienced substance use of some sort or might be in recovery themselves. But we used to have, before we bought our building where we are now in Portland, which we just bought a building last year, we were renting and our landlord was amazing. And we used to offer, so there was a couple of centers that the landlords, like somebody bought the building, the new landlord didn't want them in the building anymore. Or they'd go to sign a lease at a new place and the place, like the day before, it would like give them some excuse, like, no, we didn't realize, you know, what you were doing and we're not going to rent to you. So we used to offer, our landlord had offered that we could give out his name and number as a reference to let people know, like, what great tenants we are, you know, that we're like doing community service and we're like bettering his building and like all of the great aspects about having us there for 9 years, which is great. So all of that to say that there's a ton of stigma out there, and the public education piece is key. And to change people's hearts and minds, they have to like feel it. They have to see it and they have to feel it. And when you can make people see and feel it, and they see recovery, or they feel the need for it, that's when people's minds start changing, when you can affect their hearts. So, and that's hardest to do in rural areas because it's hard to get people to come out and say, hey, I'm a person in long-term recovery. You know, I own your local grocery store and I've been in recovery for 20 years from alcohol. Or, you know, like, especially like there's a ton of, you know, doctors, lawyers, like any profession, there's people in recovery. You know, you might live next to somebody in recovery. You don't know it because we've been silent for so long. So this recovery movement in the last like 20 years, just over 20 years, has really come about to give a voice to people in recovery and help break the stigma of being a person in recovery. because if we can make recovery fun and we can be loud about it, we can help somebody else find recovery. Any other questions before we move on? All right. So the next slide is just about the shared mission statement of RCOs. And it's really, of course, as your own RCO, you're going to build your own mission statement and your own values. However, the broad mission statement is really to mobilize resources within the community, the recovery community, and your local community to increase the prevalence and quality of recovery from alcohol and other drug addictions. So in other words, what does that mean? It's helping to build recovery capital and improve the quality of life of people in recovery in your area. So if you're not familiar with the term of recovery capital, it's a term that's used in recovery coaching a lot. And it's really just building all of those assets in our lives that help us to sustain recovery, like housing, wellness, financial pieces, like all of the things, support, family support, community support, all of the things that actually help us sustain long-term recovery. And so I did talk about peer recovery support services and how in 2007 they had become known or recognized, excuse me, as evidence-based. So SAMHSA defines peer recovery support services, often called PRCC, for substance use as non-clinical peer-based activities to engage, educate, and support individuals so that the individual themselves can make life changes which are necessary to recover. So what that means is that we don't tell them what they need to do. They decide for themselves, and we just help to support and educate them and give them resources. We don't tell anybody what to do, especially in recovery coaching. It's all self-directed, and we're just there to support and offer resources. And the really great piece about the recovery community centers is that the peer support that's offered, it can happen at any point in somebody's recovery. So we like to let providers know and community members know and just people in general that our center can offer the continuum of care, as they would say, of recovery from pre-treatment when somebody hasn't quite put down the substance yet, but they want to, all the way up to having 10, 20, 30 years of recovery, and they're in the maintenance phase. So recovery community centers really benefit people at any point and can be accessed and used at any point. It's always wonderful to see people with 20 or 30 years of recovery hanging out at our center and talking to somebody who has 30 days of recovery and connecting with them. It's really what it's all about, right? It's what when we say recovery community centers, the most important word in that phrase is community, because it's building a safe and supportive community for people in recovery. And so the services that are typically offered and what we've seen, and what I mentioned earlier, some of the centers in rural areas might do some additional things that their community needs because it's not offered in their communities, whether it's harm reduction, Narcan, because there's nobody else doing it, which is fine. But the core services that are offered are recovery coaching, telephone support, which can be really beneficial in rural areas where there's no public transportation, or people can't get to the center because they live too far away. If you're able to connect with them at some point and get their phone numbers, we have a really robust we call it TRS, Telephone Recovery Support program here, where we have our volunteers make the calls. So it's people typically in early recovery, and we train them, and they call anywhere from 50 to 100 people a week and just check in and say, hey, how's your recovery going? And sometimes the people they're calling have more recovery than the people that are making the calls. So it's mutually beneficial, you know. And there's one guy that I think he has like 10 years of recovery. He just likes getting the calls. So he always has more recovery time than the people making the calls. But, you know, he's actually able to like help the people calling him. So he just loves getting calls and he doesn't want to be taken off. So yeah, it's a way to stay connected, and people love it. And then of course the support groups, activities, family support. A lot of the centers that opened in the rural areas, I do remember, you know, that the stigma of walking into the center is real. Like if you are on Main Street or you know, in a populated area, and people see who's walking in and out of that center, the stigma is real, and it takes time. And there was I think the Down East centers, I remember a story about the first people that started coming were actually family members. They wanted to know, like, hey, what do you guys do here? You know, so that they could start referring their family. And so yeah, so we have family meetings. And if you can offer family support, that's awesome, because it doesn't have to be just for people with substance use disorder. It can be for the families as well. And then we offer typically, like I said, education, resources, and just building advocacy and awareness. So this is just a really nice graphic that RCOs value and respect a diverse multiple pathways of recovery, that we're all on our own path, and we're all headed in the same direction. It's just our journeys might look a little bit different, and that's okay. It's okay. All right, I'm just I feel like I've been talking forever. So some of the pathways that we have here, again, is SMART recovery. We have Wellbriety, which is a Native American approach. We have all recovery. All recovery, when centers are starting out and they say, you know, like, how do we get meetings started? I typically will say, well, you know, do you have any meetings in your area that are already happening, like AA, NA, SMART recovery? Because typically they're paying rent to wherever they are. If they're in a church basement, or, you know, the bingo hall, they're paying rent to be there. And if you can offer them a free space, they may be willing to move their meeting to your center. Maybe not right away, like they come, AA was one of the last ones to come to our center. They, you know, a lot of times they'll want to say, like, what are you? What are you doing? That, you know, like they'll want to feel you out a little bit before they move. But that's one way. And then the other thing is an all recovery meeting, super easy to hold. And you can be in recovery from anything to attend. I mean, food, sex, gambling, alcohol, drugs, exercise, anything. It's a very simple format. And we say, start an all recovery meeting, and then try to get the other meetings to come. And if you have people in your community that want to do like yoga groups for free, people love that. And then artistic groups. There's some new centers that do like a coffee hour in the morning, just to get people to come in and have breakfast and have coffee and talk about, like, hey, what would they like to see in the center. And so as we were talking about a few minutes ago, that it's really important to get community buy-in. And one of the ways of doing that is working with, you know, partners in your community. I know you guys have already a broad range of people, even on this call right now, and in your community, who are really invested in getting this started. But reaching out to the law enforcement, the local businesses in your area, and if you have, like, I don't know if you have a University of Maine or anything up in your area, but sometimes there's like recovery oriented campuses at the different universities where there's people in recovery, and they have kind of like a club or space on campus, getting them involved. And then local and city government, medical professionals, and churches in your area, parent and youth groups. So these are all like areas that you can reach out to and really just let them know what you're doing, build support, and get their backing, kind of, so to speak. Do some public education and some awareness building, and answer questions. They want to know, like, they want to know what you are, what you're planning to do, who's going to be there, and why do we need that in our community? So, of course, it's really hard to think that there's people out there that say, why do we need this in our community? That could be oblivious to what's going on in our communities, but there are people out there that will say that's not happening in our community. So if you could say, you know, we've had X amount of opioid overdose deaths in 2021, and you know, we want to build a safe space for people to find and sustain their recovery, and build healthy relationships. You know, like, people might not know that there was, you know, 150 deaths in Portland last year. I made that number up. I think it's higher. So what do we do and what we don't do? So again, we do support the potential for recovery in every person. So one thing that I have learned about working with people in recovery, since I've been here, I joined here in 2018, is that there's absolutely no depths that somebody cannot recover from. You know, I see it every single day that, you know, the person in your community that everybody looks down on, that might be experiencing homelessness, eating out of, you know, a dumpster, sleeping in a tent, has just as much right and ability to recover as, you know, somebody that's living in a big, beautiful house abusing prescription pills. Like, it doesn't matter like how far we have gone in our active use, like, everybody can recover. I also say that, you know, substance use disorder, alcohol use disorder, opioid use disorder does not discriminate, but neither does recovery. So it's available to us all if given the right resources. What we also do is, again, non-clinical recovery support for individuals and families. And we help to bridge that gap between clinical treatment, which is few and far between in our state right now, and ongoing recovery. So we can really kind of fill in those gaps. And again, we celebrate multiple pathways. But what we don't do, which is also just as important, because especially when you're doing community awareness, they're going to want to know, like, what do you guys do? And they're going to assume that you are doing treatment or that you are a clinical provider of some sort, which we are not. We don't act as 12-step sponsors or provide any counseling. We don't exclude anybody or promote one pathway, which can be hard, and especially in rural areas, to get a diverse mix of types of meetings. But it really can be key, because if you have somebody who's tried recovery as many times as I did, and they might say, you know, 12-step doesn't work for me and that's the only option. It's actually not the only option. And what we've learned from COVID is that we can access different options anywhere in the world through Zoom. But at other centers around the state, there's other fellowships, like, or other pathways, not fellowships, but pathways like Smart Recovery or Wellbriety, or even yoga classes that you can stream on Zoom and they can participate in from any center. We've put together a list of virtual meetings that centers can like tap into at another center around the state and offer more choices, because that might be, it might be just what somebody needs to try again, right? Like if they've tried 10 times and they're convinced that 12-step doesn't work, but you can start offering a smart recovery meeting. That might be exactly what they need, and it might work for them. So we've talked broadly about some of the benefits of having an RCO in your community, just very broadly, but it just, to put them all in front of you here, it helps people overcome barriers because you're kind of a resource broker in your community. People can come and say, I need help with this, and you can help them overcome that barrier that they're experiencing. It creates social networks and provides people with a sense of fun, again, in recovery, a community that they can connect with. It helps to reduce stigma and shame. The centers empower individuals and family members and provide hope for recovery, and it creates and sustains community interest. So you'll start finding community partners that you can work with. You might have like what's the word? I'm trying to think of what it's called, where farmers markets, for example, like we're going to start doing farmers markets where we just go to farmers markets and table just to get the word out that you're there in the community, and people can come and ask you like what you do without having to walk through the door. And it just gets the word out and starts building those relationships.
A lot of coffee.
So the 10 best practices of RCOs, this is taken from the national RCO, which is Faces and Voices of Recovery. I highly recommend checking out their website. They're called Favor. Faces and Voices of Recovery has a ton of toolkits and resources that you can use when building your RCO. How to build a board of directors, how to create a participatory process. So really this kind of lays out the 3 areas from governance and building your nonprofit, how to build your board, and who you should look for. The different programs and activities, again, it should be grassroots, and you should really involve people in recovery to offer the peer recovery support services. And then last, looking towards like diversity, equity, and inclusion, providing the multiple paths. Recovery friendly language is key to helping to break stigma, and a code of ethics for your center. This graphic, I just love it. It's about recovery ready communities, and it's taken from YPR, but it really it gives you an idea of what is needed. And of course, it's hard for every single community to have all of these aspects, but it just shows you what's really needs to be taken into consideration for a true recovery ready community. So if you start, prevention, a lot of communities have coalitions that are doing prevention work, treatment which is both equitable and affordable, even for people who do not have coverage or the ability to pay. And we all know that is lacking right now in our state. And as Gordon just said, because he's in the other room, Gordon Smith was talking about, all the work that's being done to provide more treatment in our state. Doesn't happen overnight, but we're working on it. Harm reduction services, having law enforcement on our side, right? Instead of working against us, to be working with us. Housing opportunities for safe and affordable housing, which is just out of control everywhere. Education, employment, and recovery support. And that's where we fall in up here on recovery support services. And I saw something in the chat. Is it for me? Okay, nope. All right. So again, on national recovery supports, I just talked about Faces and Voices of Recovery. It's facesandvoicesofrecovery.org is their website. And they're, again, the National Grassroots RCO, and they're available. They provide monthly meetings. You can join their Association of Recovery Community Centers. It's not necessarily cheap. PRCC is a member, so we can get all of their resources and share them with centers around the state, which we do regularly. So a lot of the toolkits and a lot of the stuff that you might not have access to as a new, struggling, brand new center, we can get you all of that information that you might need, and we have all those resources available. So this is just a map of most of the RCOs that are a part of the association of, they call it ARCO, Association of Recovery Community Organizations. And then we'll just finish up with support here in Maine. So I obviously, work for Portland Recovery Community Center. And in 2018, we received a state grant to become the Recovery Hub of Maine. And what that is essentially we offer technical assistance to communities looking to start centers, as well as the existing centers as they develop. We have developed the state certification and registration process for recovery coaches. And we provide the trainings for the recovery coaches. And then at any point that you need support, if it's something that we're not familiar with, I work really closely with all of the centers. So if it's something that I know that maybe Rockland has experienced the exact same thing that you're experiencing, I can put you in touch with Rockland and you guys can talk about it. So it's really a network. We've really built a network of centers so that we can be here for each other. I just talked about this already. This is what we do. And just a real quick, a little bit of background on, so before we received the grant, it's really funny how when you put a vision out into the community and you say something out loud, it kind of makes it like a real thing and it happens. So our mission, when we became an independent nonprofit in 2017, so prior to that, when we opened in 2011, excuse me, when we opened, we were a program of another agency, and we were kind of a pilot program. And the whole idea at that point was at some point we were going to become our own independent nonprofit once we were, had some time under us and had some structure and we knew it was going to work. So in 2017, we became an independent nonprofit. And when that happened, our current executive director was brought on board. She built a board of directors. And one of the first things that they did was create our mission and vision statement. So our mission, and this was before all of the centers had opened across Maine, is to provide support, education, and resources for people recovering from and affected by addiction, and to spread the message of hope throughout the state of Maine. Our vision that they had created was that every person affected by addiction in Maine would have direct access to local recovery community centers that provide support, education, and individual resources to help enhance their ability to heal, strengthen, and grow in their recovery pathway. It's a mouthful, I know. So as soon as we put that out as our vision, the state came up with this RFP process, and they wanted somebody to help grow recovery in Maine. And we applied for this competitive grant. We received it, and within a year, there were 7 new recovery centers open, and it was just amazing. So since then, that was in 2018. At that time, there was just us in the barn in Brewer. in Maine. And then in 2018, 7 new centers opened. 2019, we worked with 2 more communities to open centers. In 2020, we had 13, and right now we have 17 centers in our state. Again, there's one in York that's about to open. There's about 5 more communities that are in the process of opening or close to opening soon. So we're still growing. And as you know, it's a process. Our current map, which is available on our website to access and reach any of the centers that are currently open. And then this is just a graphic to show you guys. So as the Recovery Hub, we provide a data platform for 9 centers in Maine. We are looking into, at some point, bringing on some of the newer centers to the data platform as they grow. And this is some of the data that we collected in 2020, which is, of course, a global pandemic when the world was shut down and everything was happening virtually. And it just shows you how much reach the recovery centers around the state had, even during a global pandemic. You know, we had over 55,000 attendees to virtual meetings around the state. We had over 18,000 telephone support calls made around the state and over 2,400 recovery coaching sessions. And this was when recovery coaching was like really brand new in our state and just starting out. So it just goes to show you that, you know, sometimes it might seem like, you know, we're just a little small center in the corner of Maine, not having a big impact. But when you look at all of us together, and this is only 9 centers, it shows you the impact that we're actually having. So I just love that graphic. And then again, this is some of our stats for 2021, 64,000 check-ins to meetings, almost 300 coaches trained, 3 new centers last year. That's it. That's my spiel, you guys. You made it. Stop sharing. You all get a cookie.